Its icky consistency makes for lousy dinner table conversation, but the truth is, earwax is actually pretty important to our hearing health. Why? Earwax is a natural cleanser as it moves from inside the ear canal outward, gathering dead skin cells, hair, and dirt along the way. Tests have shown that it has antibacterial and antifungal properties. If your ears don't have enough earwax, they're likely to feel itchy and uncomfortable. And if you don't have the right kind, you may be more likely to get an ear infection. But for many people, when it comes to earwax, too much might not be a good thing. An ear canal plugged up with earwax can cause earaches, infections, and other problems. And not surprisingly, an excess of earwax can result in some loss of hearing. The specialist at Lake Ear, Nose, Throat, and Facial Plastic Surgery talked to us about one of the most common complaints they get, too much earwax, and how they can treat it.
When I first see a patient, I always identify that I'm a physician assistant. I think the benefit of having a physician assistant as part of the practice is the patients can get in quicker, get same-day appointments on most occasions, and our schedule isn't as tight that we can spend a little more time with the patient. We see a lot of active older people, and they are having some issues being very involved with hearing when they're in their groups or social situations, so we help address how they can hear better. Some of the common conditions that I see are nasal allergies, sinus infections, hearing loss, impacted ears, a lot of cerumen impactions, otherwise known as earwax. Cerumen impaction is a normal process of the buildup of cerumen material that's in the external auditory canal, so the outer ear, and it can block the ear canal and cause hearing loss, ear pain, infections, drainage. Some of the ways we get cerumen or earwax out of the ear canal is by using a vacuum, which is common, using a little bit of oil and suction, or some handheld tools where we can manually remove the wax. No Q-tips. Q-tips can actually cause further impaction, and some people have actually ruptured their eardrum from pushing the Q-tip in too far.
Q-tips, it's probably the bane of my existence. Q-tips cause so many problems. You know, everybody thinks that it's actually used to clean their ears and get all that wax out because it's bad. Wax is actually good, and it should be in their ear a little bit, but they should just use a wet washcloth and have it right there on the outside of their ear canal.
For more information on this story, as well as links to the specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery, click on the An Earful story link icon on our homepage at yourhometownhealth.com.